Good morning. I'm Michelle Corson, the Public Relations Officer with Kern County Public Health, and I am here to provide you with an update on COVID-19 and its impacts on Kern County. I would like to get started with the data. The California Department of Public Health, as of April the 21st, has reported 35,396 cases and 1,354 deaths. In Kern County, as of April the 23rd at 8:30 a.m., we have 699 cases, 9 non-residents, and 4 deaths. The age categories of our local cases break down as follows. Ages 0 to 17, 45 cases. Ages 18 to 49, 411 cases. Ages 50 to 64, 173 cases. Ages 65 and older, 70 cases. Of our current positive cases, 342 are isolated at home, 327 are recovered. This means 96% are either isolated at home or recovered, and we are very pleased to be able to report that number out to you today. As far as our testing goes, we have conducted 9,694 tests in Kern County, 5,372 are negative, 3,623 are still pending. And I would just like to move into thanking our community for continuing to stay home and practicing social distancing. You have been doing a fantastic job, and now is not the time to let up. So we want to reiterate the importance of this message. Stay at home. Social distance if you have to leave for essential services. That means keeping 6 feet between you and anyone else that does not reside in your household. And wash your hands frequently, and wear a face covering. If you are going out for essential services and you're not able to practice that social distancing, you can, we recommend that you wear a face covering. These are things we can all do to flatten the curve, and we appreciate our community and all that you're doing at this time. Now I would like to bring up a special guest with me today. We have Chairwoman of the Kern County Board of Supervisors, Supervisor Leticia Perez, and she is going to provide a quick update about the exciting news we have regarding the new drive-through testing site.
Thank you.
Please.
Thank you so very much. Well, I am incredibly grateful and excited that yesterday we announced the very first in the Central Valley testing location in East Bakersfield at the Prado Senior Center here on the east side. That is my district, of course, partnering with the governor on the most cutting-edge technology that is in place, the Rockefeller Foundation, investing into and helping Kern County and Bakersfield get back on track by identifying who is sick, who needs to be isolated, and who can practice these more moderate measurements, if you will, in order to stay safe and keep the reduction or keep the spread as low as possible. So I am happy to answer any questions that the media or the public may have about this process. We will have the website up and running early next week so that folks can make their appointments, apply, and then of course will receive their information over their phones. The results of the tests will be 24 to 48 hours and delivered on your phone. So we are so grateful that the governor is targeting Kern County as a place to bring in his most sophisticated technology, opportunities, and ability for us to track what's happening here so we get back to normal as soon as possible. And I am very grateful and excited to be able to offer this to Kern County. It is free. It is open to everyone. Of course, we've got to manage the process through the website, but this requires no county resources. It requires nothing on behalf of county staff. This is the governor coming in and saying East Bakersfield is important, and I agree majorly. And of course, Kern County needs some more certainty about next steps. So I'm happy to answer any questions you may have.
So what I will do is our media hit *6, and I will have you first ask questions of Supervisor Perez, and then I will be available for any additional questions. So the media, go ahead, and Supervisor Perez awaits.
Not all at once, please. Christian, do you think I covered everything?
Do we have any questions from the media?
I'm aware of that.
I have a quick question.
Oh.
Sorry, this is Tim from Channel 29. Sorry, I was muted myself. Supervisor, this is a disease that we've seen disproportionately affect minority communities, particularly our African American community and Hispanic communities. By opening up this new center, how is that a step towards addressing, this problem that we've seen emerge over the past couple of weeks?
Thank you for your question. It's a great question. What we know about the healthcare delivery system in general, right, is that it favors people that have health insurance, have resources, and know how to navigate a system. It's just the reality of the world. And so this is one more component of that reality, right? Folks that are low resource, people are afraid of the immigration system and process, people that are really unsophisticated about the healthcare system, truth be told, really need to be engaged and brought into the process so that they're not infecting their families, their communities, their job sites, and they can be empowered with the information to keep their families safe and to move forward. So the reality is in this community, our African American and Latino communities, and of course we have many areas where we have many poor whites. This is a very under-resourced, underprivileged part of the state and part of the country, and it's part of why the governor is targeting this area, is because we don't typically have the most cutting-edge software from Google here at no cost to Kern County to empower our residents to really understand how we manage this and get back on track as soon as possible. So this is really bringing a free service to a community that otherwise is not as engaged in the healthcare process and system as they should be. And that's an unfortunate reality. It is largely socioeconomic, as you know, but in this instance, it has very strong racial implications. But certainly nobody is denied, nobody is rejected. This is free for the community, and we're offering it and happy to be offering it.
Thank you.
Any other questions for the supervisor? If not, I am also available to the media.
Hi, Michelle. This is Rob King from KUZZ.
Hi.
Hi. I was wondering, the two doctors yesterday from Accelerated Urgent Care said they spoke with Matt Constantine, and he agreed with them about maybe a need to reopen soon. Is that something you can speak on? But he said he said he's following the state's orders, despite his agreements with them.
So I can confirm that the doctor at Accelerated has spoken with our director. Our director has not concurred with the statements that were made yesterday about the need to reopen at this time. What I would like to reiterate is we take very seriously the governor's guidance, the guidance from the California Department of Public Health and the Centers for Disease Control, and we want to reiterate now is the time to remain very vigilant and stay at home and practice social distancing. We know that if we practice social distancing, this is the one thing we can do to flatten the curve in our community and not burden our healthcare system. So I strongly state that that is our position, and we are so grateful. Our community, we see that you are staying at home. When I drive to work in the morning, I see the streets are much emptier. This is a difficult time for all of us. We understand the desire to get back to our lives as we knew it before this. However, the moments right now that we are taking to protect our health are vitally important. And I really just encourage our community to keep up the good work. And when the governor gives the order to start moving back to opening, that is when we will start providing you with information on how to do that safely. Any other questions?
I understand that obviously people have their own opinions and everyone's entitled to their opinion, but how critical is it for I guess, our medical leaders or people who are leaders in the community to kind of have a unified voice on something as critical as public health?
Well, it's difficult to speak on all the opinions for certain. But what I can say to that is there are top medical minds in our state, in our county, in our nation that are providing this guidance to us. And we concur that these are actions that we should be taking right now, and we are steadfast in our recommendation to our community to continue this. This is the health of our community that is at stake. And again, Kern County, you are stepping up. You are doing what we are asking. We are grateful, and rather than taking a moment to re-enter into our socialization preliminarily before the governor has given us guidance to do so, is absolutely something we would encourage you to not do. And so, any other questions?
Yeah, I have a question. This is Teddy Feinberg from the Bakersfield, California, and I was wondering how upsetting it is for public health to have leaders of the community make statements that flew directly in the face of the state orders, of the local orders, of the national orders. And if it is so upsetting, why didn't public health come out with a stronger stance on that yesterday?
Again, people are entitled to their opinion. They are entitled to speak about this topic as they wish. What our stance is, the messaging that we have been delivering remains the same. And so I can just strongly state that we are pleased with our community and how they have responded, and this is not the time to be confused. The message is loud and clear. It is loud and clear from the Centers for Disease Control. It is from our state. It is from our governor. We need to stay home. We need to practice social distancing. That is the message. It is as clear as it can be. We are eager to get back to our, socializing and our businesses reopening when that time comes, and it will. We will follow the governor, and we will do it safely and carefully.
Michelle, this is Ralph Bailey from Kern Radio.
Hi, Ralph.
Good morning. These two physicians are not only saying that schools should be open, we should be going back to work, they're saying that sheltering in place is stupid. That we are, in fact, that you should quarantine the sick and not the healthy, and that we're impacting the healthy by lowering their immune system. They're saying that wearing a mask is not only not necessary, but that it's stupid. This is a direct quote. They said by wearing a mask, it, quote, reduces the bacteria flora that gives rise to other opportunistic viruses. And they also say that we've got many cases, even in New York State, but very few deaths in a percentage-wise. Even here in Kern County, we have very few deaths. What do you all say to that?
What we continue to say is, you mentioned wearing a mask. Wearing a mask is recommended by the Centers for Disease Control. It is also in guidance from our state and our governor that if you are unable to practice social distancing, wearing a mask, more importantly, if you wear a mask and you yourself are ill, you are protecting others around you. But the evidence is starting to show you can be asymptomatic and not know you're sick, and you can be spreading COVID-19. So that's where a mask can become very important to try to mitigate the spread of this disease. Again, the Centers for Disease Control, the top medical minds of our nation, the World Health Organization, our local state officials, the guidance is clear. And we proudly follow that guidance here in Kern County. We take it very seriously. And again, I can't restate it enough. Stay at home and continue the great work you're doing in Kern County.
The other issue they say that has come from the shelter is that the hospitals are empty. They're saying that the hospitals are empty not only because the minor surgeries have been cut out, but because people are afraid to go to the hospital. And that there are floors of hospitals that are closed
comes to our hospitals, you'd have to speak more directly to them. They, however, are doing their best to prepare for a potential surge. This is what we have been, as a community, tasked to do, because again, we take this seriously. We hope that doesn't happen. We hope that social distancing, that plays a major role on the potential peak of this disease in our community, will not have an impact of surge in our local hospitals. So that's what's key here is, but in case our hospitals become impacted and reach surge, we are prepared as a community to address that. We hope we don't have to, but if we do, we have been preparing for this, and we take that seriously also.
So would you say that some of these statements made were dangerous to public health? To the greater public health, not to your organization?
I want to just reiterate, we do not agree with the statements that were made in regards to not social distancing and not staying at home. We can just reiterate what we have been reiterating and thank our community for doing such a great job, and now is not the time to let up.
One of the points that they make is, how can a Costco be open and a park be closed?
So our parks aren't closed. Some of the amenities in our parks are closed. If you want to go out and walk and exercise, we are encouraging you to do that. So when it comes to the businesses and the essential business list that was issued by the governor, we continue to work on that. Our health inspectors are out working with businesses, and there aren't easy answers other than we're following again the guidance of the essential businesses laid out by our state. And this is difficult. We know this is difficult on our businesses. We work with them on a daily basis, and we appreciate our businesses because the majority of them are taking this very seriously, and they are doing what is being asked of them. And this is a trying time for us all. The key here is, and I want everyone to hear this very clearly, through social distancing, that is the one thing we can do to impact this curve, flatten the curve, and hopefully get back to our daily lives as soon as possible. So encouraging our community to stay steadfast is a very important message right now. Are there
I have another question about the testing center.
Okay.
For either yourself or the supervisor. Sorry to take it back a little bit.
Oh, no, completely fine.
I know testing is critical, in addition to the social distancing, to help us flatten that curve and get our lives back to normal as soon as possible. For this new center, is it going to be anyone can show up and get tested, even if they're asymptomatic, or are there still certain criteria that folks have to meet, or what is the plan for that?
Thank you. Great question. Part of what's so insidious about this particular virus is that the majority of people that are infected or carrying this disease around and infecting others by coughing and laughing and singing or doing whatever it is that human beings do to be social, infecting others, no one can tell that they're sick. They can't tell that they're sick. That is what asymptomatic is. This is a major problem because it, of course, has caused great frustration because people look around them and say, everybody looks healthy to me. Why can't we come out and just have life as we used to? They're great questions. It's just remarkable frustration that we're experiencing. But the truth is the spreading that's going on with asymptomatic people is the problem. Because the most vulnerable, and some of this appears to be random, we'll know more in 5-10 years, but there are blood type issues and what your sex is, what your racial background is potentially. I mean, all of these factors can cause this issue to be remarkably catastrophic. We saw a 5-year-old young girl dead for the first, our first child victim. I've read stories where the entire death populations are 100% African American, for example. I mean, the inequalities here are profound, and we have to have a universal system by which we are testing methodically and regularly to know that sick people are being isolated at home. They are only being around their families and treating themselves at home. In this particular testing process, if you are positive, you will receive a call from a physician who will guide you about how to treat yourself at home, who will be able to take a look at you over the internet, right? This is the new norm, and get a sense about symptoms and about likelihood and the need to take certain actions. This is a way for us not to overwhelm our healthcare system, not to spend money unnecessarily on treatment and the paranoia that exists when people are concerned for themselves and their families. This is a way to manage that process, guide it over the next few months so we really know where the hotspots are, how we can really aggressively intervene to do more social distancing, and where we can frankly let up, because we are now transitioning into some normalcy, and that requires us to manage, track, and understand who's sick, where they are, and how we get people back to normal. And this is the first step for us to make that possible. We're the only site in the Central Valley. We certainly hope to have more, but in a place of limited resources and fierce global competition, it appears as though Kern County is on the cutting edge. I'm proud of that. This will be the finest testing facility that we have ever had. It is consistent, the highest guidelines at CDC. And I am so pleased that the fine folks of this county who are, reminding us that we are our neighbor's keeper. And I so appreciate you. So that's a long answer, but there's a lot there, and we have to manage and track the way we do, that we just have to manage and track, and we can't sit back and go, well, you look sick, and is that a dry cough, or every day at my house, is that dry or wet, right? We don't know what's happening or what the next steps are, and I think the people deserve more direction. They need some clarity, and this is a step in the right direction.
One from, so on that note, is it open to...
I'm sorry, sir, he's still talking. I didn't hear either of you, so forgive me. I'll come to you in just a second. Sir, could you repeat that, please?
I'm so sorry about that.
It's okay.
I was a quick follow-up. Do folks have to live in East Bakersfield, or is it open to any resident in Kern County?
Thank you. It's open to anyone. You will be applying online, going through the process of getting appointments. The process is very smooth. You make an appointment online. You come through in a pure drive-through process where there's very limited interaction whatsoever. A very, very high standard CDC-style test will occur. It will not be long. You will not have to come out of your vehicle or interact with anyone. You can go home. You don't have to come back again. You'll receive your results within 24 to 48 hours. And if you are positive, you will receive a call from a physician who will guide you in the next steps, how to treat oneself at home, how to think about the next steps, and if symptoms are getting worse or better, some context by which to take more control over this process and make sure that we're managing our health in a way that doesn't overwhelm the system, is honorable to the taxpayer and their investments, and also really is cutting edge in the kind of technology that we have to employ and think about going forward, because these issues will not go away. Not in a globe with 8 billion people. It's just not happening. So you had a question?
The question was the same, just about making sure that we're testing everyone, even if you believe you're asymptomatic or if you're really a head of household, go and make sure that you're tested properly.
That's correct. This site will eventually offer antibody testing as well. I mean, we are gearing up in record speed, this is, what's so exciting about the public-private partnership of this is how quickly the private sector, when it is engaged and when it has good power players like Governor Gavin Newsom, who are saying, come help me in this process. Give me your best technology, your best minds, your best science. So we capture this and lead, as California always does. So I am so pleased that Kern County is on the front lines of that. I understand that there are differences of opinion. There are frustrations here of which none of us have ever experienced before. It means we'll have some disagreements. It means there will be tension. It's okay. What we need to do is look at the science, at the data, help folks get empowered with understanding if they're sick and if they need to quarantine and if they can treat themselves at home. How do we protect ourselves, our neighbors, so we get back to normal as soon as possible?
And just the last one, I guess, on behalf of Mr. Ralph Bailey to the health department. Go over that part when we, label the cause of death of someone. How we do that, why we do it that way, or is that just through the coroner's office when we label someone, deceased because of COVID-19? You guys obviously know that there's a lot of misinformation when it comes to things like that.
Yes.
How do you bury that?
When it comes to any deceased individual and whether they have been tested for COVID-19 or they are tested after, that is determinations that are made by the healthcare provider overseeing that or the coroner. So those are the folks that are involved in those decisions.
Really, there's no benefit in trying to label someone as that, right? That's what.
Yes, it's difficult to speak to that. I think in the future we'll be learning a lot more. We've heard some stories up north All I can do is refer you locally to our coroner and healthcare providers on that. And back to my phone line, I have time for one more question, and then we'll have to wrap it up.
The supervisor, 5-year-old Pat, was that a local 5-year-old?
Not to my knowledge. The supervisor, I believe, was speaking of a national case.
Okay, thank you.
And Ralph, did you have one more question, and then we'll conclude?
I did. Thank you, Michelle.
Sure.
You know, I don't know if you understand how popular this news conference that went on Facebook is and how people are agreeing with these guys. And they aren't a pair of residents straight out of med school. These are two well-known, very respected doctors. Piggybacks on an earlier question, why hasn't there been a stronger opposition to this from the public health department? And where is Matt Constantine? The president addresses the media every single day. The governor addresses the media every single day. And Matt Constantine doesn't even come to these 2-a-week press conferences?
Well, to be very clear, our director has definitely done some of these press conferences. I know you're a new attendee, Ralph, but he has done many of these press conferences, as well as myself, as well as presenting to the Board of Supervisors on a regular basis that is televised. So we will continue as a department to deliver the messages that we are taking very seriously. We are not able to address others in the community that have a differing opinion to what is being told to us, again, by national, state, our governor, guidelines that we should be following. So, you know, as I conclude, I want to really thank our residents for staying at home, practicing social distancing. We hope that there is good news on the horizon, but now is not the time to abandon the good practices we've all been implementing. So we're going to continue to provide you updates on a regular basis. Visit our website. Our call center is open. And thank you, Kern County, because you're doing a fantastic job. So stay safe, and we will talk to you next time. Thank you.